Welcome to the presentation on predictable, proactive, and profitable minimally invasive dentistry. That's certainly a mouthful and a bit of a tongue twister. You're in for, I think, a treat. I am very excited to be a dentist today. I've been a dentist for many years, and it is truly a golden era of dentistry. We have materials that can do things that we couldn't do in the past. They are bioactive materials. We have techniques that can do minimally invasive dentistry, and what I like to call proactive intervention. That means we're not just watching and waiting. We're actually understanding the process and working with it. I consult for, work with, the following dental manufacturing, distribution, and trading companies. The list is long, and it's really exciting to see that there are many companies that are willing to listen to dentists, to what dentists want, to what dentists need. And if you're willing to go and speak to them, they will be listening to you as well. Bioactivity is a term that is bandied about quite a bit today. Basically, it means it's something that has an effect on, interaction with, or response from living tissue. That's it. Something that works with living tissue. The concept came about in the early 70s when a lot of Vietnam vets came back with major bone issues and bone injuries, and they had to find a way of healing these bone defects. So there was a lot of research at the time. And also at the same time, there was a lot of work on tooth and tooth material because, as we know, enamel is very closely related to bone. At that time, glass ionomers were developed, and there was a lot of interest in the idea of working with the body and with whether it's bone or tooth material to heal and work proactively in that way to get things working and healing together. Along with bioactive materials, we need a minimally invasive preparation system. This is the way to do dentistry in the 21st century. S.S. White has developed what they call the Comfortable Cavity Preparation System, which does all this. It is minimally invasive. It is a system that has very little need for anesthesia. The patients are very comfortable, and it's very easy and quick to use. The first part of the comfortable cavity preparation system is the granddaddy of it all, the fissurotomy system. It's the first part, the first link to true conservative dentistry. This is a system which has design all over it. It's designed specifically to very easily and comfortably remove fissure caries and to expose hidden caries. It's good for early detection, as well as conservative treatment, and for a minimal need of anesthesia. So you have preservation of tooth structure to ensure that a tooth survives for the patient's lifetime, and also minimal need for anesthesia, which brings us to very happy patients. The design ensures that the overall head length allows for the full cutting to the DDJ, but no further. If it stays within the enamel, there is less pain to the patient because the enamel does not have any pain perception. As well, there's a small tip which conservatively explores the fissure system, and that, again, allows for very little touching of the dentin. It's mostly the enamel that is being cleaned out. The back diameter of the cutting head is designed to accommodate all popular explorers, so you're able to detect things that are going on around because it opens up the area for view. Traditional burrs do not take into account the anatomy of the tooth, specifically the anatomy of the occlusal surface with its complex pits and fissure system. As we can see on this side, the traditional burr is very wide, and it indiscriminately removes a lot of tooth structure. On the other hand, the fissurotomy burr is tapered, and it works with the tooth to remove just what needs to be removed, basically removing the caries and presenting very little to the dentinal surface. So we have a system where the tapered prep preserves the tooth structure and is very conservative, and the taper also presents less surface to dentin, making for a much more comfortable patient. The fissurotomy burr has been shown to be the most conservative burr that can be used for class 1s, pre-sealants, and for many other indications. At full depth, the fissurotomy burr removes 42% less tooth structure than the 330s and about 73% less than the 557s. The Smart Burr 2 was also developed with patient comfort and tooth preservation in mind, especially when it comes to situations where more tooth has to be removed because there are deeper caries. The Smart Burr 2 is a smart burr because it really knows when to stop. The Smart Burr 2 is a polymer burr, a plastic burr. It's harder than decay, but it's softer than healthy dentin, and it's softer than secondary dentin. Metal and diamond burrs cut infected and healthy dentin indiscriminately. This opens up the dentinal tubules, and this causes pain. Smart Burr 2 is a burr that cannot cut healthy dentin. It cannot open the dentinal tubules, and then it can also not cause dentinal pain. When a tooth has deep caries and you remove the caries with a carbide, there is no proprioception. The carbide and your fingers and the way you're doing the dentistry with the burrs, the traditional burrs of the past, there was a lack of proprioception. And you always will have a lack of proprioception because we cannot feel what's going on at that surface where the burr is cutting. And this often results in a pulp exposure. On the other hand, when you remove deep caries with a smart burr, it can only cut the soft infected dentin. It's going to be stopped by the non-infected dentin, so that way it's self-limiting. It will wear itself out before the tooth will wear out. So you cannot remove anything that should not be removed. So it's a safety mechanism, and it helps with not removing too much tooth structure, not creating a situation where the patient may need a root canal when you've had a pulp exposure, and also making for a much more comfortable patient. There is no special learning technique or anything new to learn when you're using a smart burr. You use it the way you would use any slow-speed burr. The way it works is you apply the smart burr gently. You don't use a lot of force. And it's going to go with a very slow rotation. And basically, you're removing the carious materials slowly and carefully until it just stops. It'll stop when it hits healthy or secondary dentin. The smart burr is going to wear itself out first and not wear out the tooth. Composite resin restorations usually take quite a long time to polish. That is usually the most time-consuming part of the whole restorative process in doing composites. The comfortable cavity prep kit provides a new burr system called the Jazz polishing system that is a single instrument. There are many components that you can use, different shapes, the cup, the point, and other items It's a single-step system. It saves a lot of chair time. The polish depends on the speed and the pressure. You can vary that yourself. So it's very easy to complete the restoration process very quickly and easily. There's a synthetic rubber matrix that is infused with diamond particles, and that is the reason that it works so well, and gives the restoration a very nice, rapid high gloss. This is usually the longest part of the procedure in doing restoration, and it really is a great time saver, and it gives you a really nice result. Now let's talk about caries management. We're using a medical model now. If we're using bioactive materials, we have to understand the actual process. Remember, I mentioned the concept of proactive intervention. We can't just watch and wait. We can't just see what is going on in the system and let it go as it is. We have to basically modify it and manage it, and this is the medical model. We know that caries are the pathology behind caries. It is a transmissible bacterial infection. It is controlled through many means. The other thing that can make it more problematic is diet or salivary dysfunction. In terms of the protection, which we use in the caries model, we can use antimicrobials, healthy diet, saliva can be improved, tongue cleaning and remineralization products, as well as xylitol. The first thing that's really important to understand is the role of these antimicrobials. And the first antimicrobial that we will be discussing will be fluoride, because that is basically the first thing that was developed for the concept of bioactivity. Remember, I mentioned that bioactivity means anything that works with the body, with the oral cavity, to either improve or make something worse. It works with the patient. So that's what the concept of bioactivity is. So now we have to understand the different components, the different chemistry that can either improve or make the oral cavity in a worse situation and cause the caries process to get worse or to get better. How does fluoride work? When a patient eats something, no matter what it is, there is a change in the pH. Basically, what happens is the pH goes down because of the fact that the acids in the oral cavity break things down so that it's easier for digestion. So that means the pH drops quite significantly. That can be a problem for the teeth. And what happens is when it goes down to a certain point, it reaches critical pH. This is the pH where demineralization starts to take place. As we can see here at 5.5, pH 5.5, that is when demineralization starts to take place. Below 5.5. At 5.5 itself, that's where the situation is at equilibrium. There's no major demineralization. There's no major remineralization. And that is important because we know that when the patient eats something, if the pH goes down below that, you are going to be having demineralization. Adding fluoride to the oral cavity changes everything. Whether you put it in with a rinse or a restorative material or any kind of varnish, we're changing the amount of fluoride in the oral cavity. So we can actually fluoridate the enamel. We get fluoridated hydroxyapatite. So the tooth is stronger. It's more able to withstand the changes in pH. And what actually happens is the critical pH changes. The area where equilibrium is established changes. The critical pH goes down to 4.5. And demineralization only takes place below pH 4.5. So the teeth in the oral cavity are protected. And also, remineralization will take place above 4.5. The oral cavity is in a constant state of having the teeth demineralize and remineralize. This goes on constantly. So you're changing the balance, and it becomes a lot easier to help the teeth and strengthen the teeth and create a situation where bioactive materials are a lot more important. This all takes place with the help of saliva. Saliva is basically like a bloodstream within the mouth. It helps to maintain the health of the soft and hard tissues that it comes in contact with. The functions of saliva are to remove waste. It contains proteins that fight disease, and it offers the first line of protection against microbial invasion. The fluoride reservoir is something which will become very important later on as we discuss how bioactive materials work later on in the presentation. The fluoride reservoir is the area on the outside of the enamel surface which stores fluoride and is very important in the remineralization process. Only micro quantities of fluoride are needed to have an impact on the and demineralization process occurring at the enamel surface. After a topical fluoride application, for example, calcium fluoride-like precipitates form throughout the mouth. They're all over the mouth. And these precipitates are actually stored in the plaque and on the enamel surface. Some of the precipitates are viewed as a fluoride reservoir. So this area on the external surface of the enamel is where all of this fluoride is stored, and it becomes very important in the remineralization process and in the bioactivity of a lot of dental materials. When plaque acid occurs, the calcium fluoride-like material in the reservoir dissolves before the enamel. So it releases the fluoride exactly when and precisely where it is needed. Fluoride works to prevent caries by boosting the ability of the saliva to return the lost minerals to the tooth enamel before caries can develop. Here are the three major groups of bioactive restorative materials that we'll be discussing. Glass ionomers, the granddaddy, the ones that were around since the 70s and have been tremendous in terms of helping remineralization with their fluoride release. Then the gyomers, which have taken the best of composite resin attributes and added on the attributes of glass ionomers, and you actually think that you're working on a pure composite resin, and yet you have a lot of the benefits of glass ionomer. And then the tricalcium silicate cements that could actually help you heal dental pulp. Glass ionomers were there right at the beginning. Remember that bioactivity is defined as having any effect on interaction with or response from living tissue. Things that work with living tissue to change them and work, usually we try to get it to be something positive. They can be positive or negative. That is the definition of bioactivity. Here we can see the effect of the glass ionomer material on the dentin surface, specifically the hardness of the dentin surface because of the addition of minerals, of fluoride. And you can see on the pink line has glass ionomer. It is significantly stronger and harder than the area without glass ionomer. Glass ionomers are not for everybody, and they're not for every indication. They are indicated in class 1, 2, and 5 posterior restorations in high caries risk patients or pediatric patients, geriatric patients, special needs patients, or when they're needed for local location or isolation issues where you can't get a light, curing light into the area, or there's a lot of exudate or bleeding, or it's impossible to isolate the area. That is the indication for a glass ionomer cement. Gyomers are a unique restorative product that was developed by Shofu. It's a pre-acted glass ionomer-based material. The gyomer concept is a technical attempt to hybridize the characteristics of both glass ionomer cement and composite resin, and take the best of both of them and marry them. Basically, take the handling properties of composite resin and the aesthetic appeal of composite resin and hybridize that with the glass ionomer's ability to release fluoride and its healing properties. This is the concept of gyomer. For a little bit of the science and the chemistry, what we have is a multifunctional glass which goes into a polyacrylic acid bath, and it goes through a glass ionomer reaction. And at the end, we've got a glass core with a glass ionomer phase around it, a surface-modified layer around that. And that creates a stable glass ionomer phase, and that is the gyomer technology. The glass ionomer advantages are because of the chemistry. As you can also see here, surrounding the glass and the glass ionomer phase, the surface-modified layer has quite a few ions like fluoride, sodium, boron, strontium, and aluminum, etc. They are responsible primarily because of the fluoride for the fluoride release and recharge, but there's also an anti-plaque effect. And we know there's dentin remineralization because of the fluoride, and there's also acid buffer effect. So there are many positive attributes to gyomer technology. The anti-plaque effect is tremendous. As we can see on the left side, Beautifil 2, which is a gyomer, has almost no plaque on the surface after 24 hours. Whereas the other material on the right side, which just is a simple composite resin that's not a gyomer, has very mature and quite extensive plaque formed over the first 24 hours. The gyomer restoration creates its own fluoride reservoir. We discussed fluoride reservoirs a little earlier with respect to saliva in general, but here we have a very strong fluoride reservoir. When there is a higher concentration of fluoride in the oral cavity, the fluoride recharges into the gyomer. On the other hand, when there is less fluoride in the oral cavity and it may be needed somewhere, gyomer can release the fluoride to the area that it's needed. So it creates this extra fluoride reservoir, a very strong fluoride reservoir in the actual restoration. Beautifil Flow Plus is a gyomer technology in a flowable. It has all the attributes of the gyomer as well as very good handling properties of a flowable. When the company first said they wanted to come up with a flowable, I said, oh, I don't think you need it. But I've been using it extensively in more and more things over time, and it is a tremendous flowable to add to the armamentarium and to use in a lot of areas that you wouldn't think you could use a flowable. Beautifil Flow Plus has the physical properties to rival hybrids. It's got incredible handling, great handling of flowable handling without the drip. It stays put where you want it to stay. The aesthetic finish is tremendous. It's got the gyomer fluoride release and recharge attributes, as well as the anti-plaque effect. It comes with 2 viscosities to suit all indications. The physical properties of this flowable rival the physical properties of hybrid resins. The physical properties of this flowable material were tested against rival hybrids. And they were tested in against load-bearing materials for compressive strength, flexural strength, elastic modulus, and wear resistance. And they came through with flying colors to rival these materials and match them for all these attributes. Beautiful Flow Plus is very radiopaque in both the 00 version as well as the 03 version. The handling and flowability of Beautiful Flow Plus is what makes it a star. As I mentioned, Beautiful Flow Plus comes in two viscosities. There is the low flow, which has a bit of flow, as well as the non-flow, which basically stays put and doesn't go anywhere at all. And the great part is they're both non-slumping, self-leveling, and non-sticky. They definitely go where they're put, stay there, and the handling properties really make this very easy to use. They level themselves and hold their shape with or without a matrix band. With a lot of the other flowable materials, you have to use an instrument or a burr to shape the material, and that becomes much more difficult, more time-consuming. This material does not need all that. Dentists can be divided up in two groups. You're either a builder or a carver. The carver likes to put in layer by layer and then cut it down and create the shape. The builder likes to create the shape as it's being built. So you make your marginal ridges and all those other areas, and the fossa and all the pits and fissures are created as the material is being built up. You can use flowable for both these techniques. Let's get into some clinical examples. Here we have a caries treatment map from the Spectra system by Air Techniques. First we have visual. Then there is a detection mode, which the Spectra provides, as well as the analytical mode that shows us exactly where the caries are and how deep they are. Over here we have the initial situation on the upper left. We go in with the fissurotomy burr, which, as we explained before, is the most conservative treatment and the most conservative way to start any occlusal surface area decay. Then on the lower left, we see there is still some soft decay, which has to be removed by the smart burr 2, which is shown on the lower right. Once the soft decay is removed by the smart burr, bonding is placed, it is dried and cured, then the flowable material is placed. In this case, it will be the Beautiful Flow Plus 00, and then it is cured, and you see the restoration prior to polishing on the lower right. Very simple to do, very predictable. It's proactive and predictable, and also quite profitable because it is a very quick procedure, very comfortable for the patient. No anesthetic had to be used, and it's a win-win for the dentist and the patient. The completed restoration is then finished with a football burr, whether it be a diamond or a carbide, and then very easily polished in one-step system through the jazz polishing system. This creates a mirror-like finish, which is seen on the lower left. Many of us have patients who have worn dentition, and these patients can very easily be treated with flowable composites. And it is very easy to use and very forgivable. You can add to it, you can subtract. Whenever things have to be done, they can be done easily. This gentleman was in his 70s when this was done. It took him 60 years to wear those teeth. And if it takes him another 60 years to wear them now, that would be great for him and for me. And I'd be happy to take care of him for those 60 years. The perimeter repair of the worn restoration shows predictable, proactive, and profitable minimally invasive dentistry at work at the dental chair. Here we see a restoration that is worn out, possible redecay around the margins, definitely staining around the margins. The top center shows the fissurotomy burr at work, removing this area of decay only where it has to be removed in a very minimal intervention way, as well as not being giving the patient any sensitivity at all. On the top right, we see the very minimal preparation. And after that, we have the rinsing and washing of the prep, the bonding, the drying, and we're at the stage now for the flowable material to be put in the next slide. The bonding is cured, the flowable is placed, and on the right bottom you see the completed restoration, rejuvenated restoration from what we had before in under 5 minutes. This is true, predictable, proactive, profitable, and comfortable dentistry. There are many other instances where we can use the SS White comfortable cavity preparation system with bioactive materials to create conservative preparations and repairs, such as this area here, where we've got a class 1 cavity just in the center of the restoration where there is a defect, and then very easily it is prepared, repaired, and restored. Again, under 5 minutes. There are countless ways of using this system in everyday bread and butter dentistry. Here we have a conservative preparation in the posterior region. We're treating a class 2 prep in a class 3 fashion. This way we maintain the marginal ridge, and it gives the patient the chance to keep the tooth for a longer period of time. Every time we go in and remove some more tooth structure, we know that we are down the road going to have a problem in terms of longevity. Here, maintaining the marginal ridge will give the patient a much better chance of keeping the tooth for a lifetime. Here we have a very conservative, minimal preparation of a class 2. It's as narrow as possible and very easy to maintain. Right after that, you can just put in a flowable, and that with the bioactive flowable, like the Shofu Geimer, you are protecting that area, and that way it can be easily maintained, and it can last, again, last a patient for a very long time, if not a lifetime. Now for a bit of science on biodentin. The chemistry is synthetic tricalcium silicate with active biosilicate technology. This is a prime example of bioactivity. Science has been 10 years of extensive research which has found optimal biocompatibility and evidence of remineralization. And ultimately, the most important benefit is the preservation of pulp vitality. No other material does this in such a way and in such a great way. The activity at the dentin surface is the following. There are reactionary dentin bridges that are formed, And this promotes pulpal healing. Pulpal healing after the following possibilities: either pulp exposure, irreversible pulpitis, trauma, and even iatrogenic exposure. There is bioactivity at the dentin interface. No surface preparation is required. There's an excellent seal with mineral tags into the dental tubules, no resin, so there's no shrinkage, and it also provides high dimensional stability. It's bacteriostatic at a pH of 12. It also has excellent radiopacity. Of course, this is very important when you've got a very deep lesion. You really want to see what's going on and how close you are to the pulp. The radiopacity is equal to 3.5 millimeters aluminum. Biodentin truly saves teeth. As we can see in this example, a very deep lesion in a second molar. And here we see it being restored with biodentin first. Then the biodentin is removed 6 months later and a permanent restoration is placed. Today, I would not even bother doing it this way. What I would do is I would place the biodentin immediately when I remove all decay with my smart burr. And I take out all infected dentin. And as soon as that's out, I will place my biodentin as a base and then put my permanent restoration on top of that. We don't need that intermediate step. The more steps, the worse it is for the longevity of the tooth. So that's how I save teeth today. There's been a tremendous paradigm shift in dentistry over the last few years. It's a paradigm shift from the surgical model to the medical model. And this is the predictable, proactive, and profitable minimally invasive dentistry model. It's minimally invasive because we know that we want to remove as little as possible, but this is a passive approach. We have to be proactive. Proactive intervention is a type of dentistry that should be understood and practiced. Patients love this approach. We don't want to watch and wait. We're able to map and evaluate caries scientifically in a predictable, reproducible, and clinically significant way. We can evaluate whether restoration is repairable or should be replaced using the perimeter restoration. The perimeter prep is an innovative way of repairing aging restorations. These are all things that we can use for our patients. Our patients appreciate it. We appreciate it. Our bottom line appreciates it. These are all the things that we have to use and we can use because of all the tools that are available to us. The tools that are available are the 20th century cavity preparation tools, like the Comfortable Cavity Preparation System by S.S. White. This has the fissurotomy, which is minimally invasive, conservative, and it doesn't allow the patient to have any sensitivity or very minimal sensitivity, as well as the SmartBird 2 that is smart enough to know when to stop removing caries and just to get the infected soft dentin. And the jazz polishing part of this, which gives you a very quick way of polishing with a one-step system. And we have the bioactive materials. These are the healing materials. They can heal teeth and reduce restorative failure. They can heal pulp and possibly avoid root canals. These are materials like glass ionomers, gyomers, and biodentin. This is truly not science fiction anymore. This is dentistry as it should be practiced, and it is practiced every day in lots of dental offices worldwide. We live in the golden age of dentistry. This is the age of healing dentistry. Many of the techniques are easier and faster than traditional dentistry. Patients prefer to be treated in this manner. And our bottom line is helped with this system. This program has hopefully shown you a way to create a new type of dentistry in your office, a predictable, proactive, and profitable practice with patients for life. This is the idea where less is more. It is better, it is easier, and it is the way we enjoy practicing dentistry. Thank you so much for your attention, and I hope that I've given you a lot of food for thought.